evening. It is April 11th, 2023, 6:05 in the afternoon, evening, and we're going to call the meeting to order for the Town of Northborough Board of Health. Some tea this morning.
She did send me an email saying she's held up at work, so
Okay.
hoping she might come later. The only thought, regarding the agenda, I knew she had some interest in discussing the regional high school project. That's at the end of the agenda, but,
All right.
she might make it. We'll have to wait.
Well, we're just going to plow through without her.
Okay.
Hopefully she'll show up. Hopefully she'll be able to make it. Sounds better. Okay, number one, we'll go right through the line. Consideration of revising Northborough Board of Health tobacco regulation. No vote to be taken. This is a doozy to start off the meeting with. It looks like the last time we had tackled this issue was back in 2015, so I'm assuming that things are changing. I know it changed with the vaping,
Yeah.
and that's probably what's kicked this thing off.
Yeah.
So if you want to
Sure.
give us a little rundown.
Sure. So, yep, you are correct, Mr. Chair. Our tobacco regulations in town were last updated in 2015. Since that time, the state's adopted flavor bans on tobacco and nicotine products, and, the maximum amount of nicotine in electronic product, etc. So our local regulations are less restrictive, and it's caused some confusion as Michael was doing compliance checks. So I'm going to hand it over to Michael in a minute. He's been working with the Massachusetts Health Officers Association, the MHOA. They have a grant that's funded through DPH, and they provide technical assistance to local boards of health. So, for example, Kevin Duquette was the agent that Michael went out with over a month ago to do that first round of compliance checks. So while I want to, this agenda item is really specific to our tobacco reg, just to, quick, big overcap where we are in tobacco compliance. We're checking with town council on the fining process. Michael has gone back out to some of those establishments, but we just want to make sure we find them correctly. We did issue warning letters for the first on the previously discussed violations. So we're working through that and waiting for a response on council, but the point of this agenda item is really for Michael he's done a lot of research on the reg to sort of talk about the model regulation that MHOA suggests we adopt, and that not get into the nitty-gritty today per se, but just to see if there's a consensus from the board on moving this forward and officially posting a hearing notice. So when any local board of health adopts a regulation, if it's Title V, you have to have a public hearing. If it's anything other than Title V, it's recommended that you would have a hearing. And what's really best practice is if we were going to put a draft forward, that the draft would be available and that we would post a hearing notice, as well as notify all of our retailers in town that we're currently looking at it. So my thought is today, let's get a general idea of where you feel about it. Michael can sort of talk you through a summary, and then the board would maybe just have a consensus, no formal vote needed, to say, yes, let's move forward in our next agenda. We'll actually post the hearing notice in time. We'll invite those retailers. And I would say it typically takes about 2 meetings minimum to pass a regulation. The first meeting, we'll look at the draft, we'll decide what sections, we'll take that input, and then we'll have a cleaner draft to officially vote, 2 meetings from now would be my recommendation, or as long as it takes. So I'll hand it over to Michael.
Thank you very much, Kristen. So you have 2 packets in front of you. One, this is sort of a sample regulation that they put together from the MHOA and the HP, Association of Health Boards. It is an exhaustive draft that lists everything that could change. There's highlighted yellows, which is new language, and the highlighted greens that are much more left up to the towns. Whether there's for example, cap on licenses and things like that. So there's a lot that they recommend. My suggestion overall is to adopt mostly everything for the most part to get in line with the state's mass general laws regarding smoking. So the second packet is the smaller one. The first part is taking pretty much all those green sections that I had mentioned and with my recommendations. And on the second page are about 2, 4, 6, 8 local towns in town. Some of them have updated them over the past few years and some of them have not. But some of the language that I suggest we adopt. Everybody else has adopted most of that in some form. Not sure how, I don't wanna go through line by line, but as she mentioned, our regulations were last updated in 2015. So even though there is a state ban on flavored tobacco, it's not in our regulations. Technically, someone could sell non-filtered
I'll check
cigarettes,
what
but
you
not,
want.
well, I shouldn't have said that. Cause it's not in our regulations, even though it's a state regulation. The manufacturer letters that I mentioned at the last meeting are not in our regulations. That's really important stuff.
Do we have to have these, if it's in the state, do we have to have it in the town?
That's why we're still working with council a little bit, trying to figure out how to find, what the finding structure is. And can we find state violations with their recommendations or with town's recommendations?
If the state says no flavored tobacco products, can we have flavored tobacco products?
No.
Or it's just banned outright?
It's
Yeah,
banned.
we could be more restrictive than the state, so some of those
Okay, yeah,
add-ons, so we're gonna follow the state, and the possible add-ons would be blunt wraps, or we could
Well,
do
that's already in the-
in our local regs, but not in the state's model
Right,
tobacco.
that is, I think the only thing that is completely up to the municipalities, is the ban on, which is tobacco leaf for you to roll tobacco, in any fashion.
All this, that's the only thing that, they left alone?
That is, in all my research, that's the only thing that's not in the federal or state regulations, but the towns can adopt it, I'm not quite sure why.
And I think it's really important, one of the most controversial, I went through this same process when I worked in Uxbridge of updating our regs, and the state model regulation does recommend a cap locally on the number of establishments. They recommend that it would be one establishment per 1,000 residents in town, so Northborough, 15 to 16 permits, which is pretty much exactly what we do have. But that's really up to the board, right? Whether or not you'd want to put a cap on the number of establishments or leave that out. But I think the general language we'd like to move forward with, that there's additional add-ons of how far you can be located from a school, is one we've seen added to other communities that's mentioned in these model regulations. But in Northborough, I talked with Michael, that's one of those where we say, we don't really have that much business next to our schools in Northborough, right? Like, we don't abut a downtown school. So maybe some of those, we don't really, with the zoning, there's really not a need to adopt that, for example, a certain setback. So, there definitely are add-ons that need to be a discussion on the board.
The closest business to Algonquin is 1,700 feet or something.
Yeah.
So
Oh, is it?
Is that the convenience
it's
store?
over that, the Bacon's Wine and Spirits.
Okay.
Yeah.
I think the closest thing, unless I missed something.
Yep.
That is over 2,000 feet. So, out of the 8 local places, I just chose the one that are closest to us. 5 have a cap on permits, the other 5 don't. Almost everybody has a dollar value that you can sell single cigars at to discourage too many children from buying them. Usually around $2.80, something like that. That was what most of the other towns have done. Almost everybody adopted some distance from schools, which we don't necessarily need to worry about, but do we have it in there just in case something ever happens? The other one that is suggested, but it's certainly up to us, is whether we have a distance allowable between other tobacco permits. Can Bacon's Wine have one, and then the Tennessee place become a smoke shop across the street? Is that acceptable? I don't have an argument necessarily either way, but it's something to discuss. I don't, unless there's something more to add, that why we would or not do that. And then the suggested fine structure, there's the state law violations are $1,000 for the first fine, $2,000 and $3,000 progressively. Currently, ours are 100, 200, and 300, as 300 is the cap of non-criminal disposition. But this goes back to what we're allowed to do. We're still working with council to try to figure that out. Whether we are allowed to adopt, according to this at least, we can adopt the state fine structure if we want to, fine 1,000 for every first violation. None of those other 8 towns did that. They've all stayed with the 100, 200, 300. A couple of them went 300 across the board, because that's the limit of non-criminal disposition. But adopting the state is an option according to these regulations, but maybe not from council yet. And the only other thing that we have a major discussion on, that we have a choice on, of a number of violations in a certain time frame. So if their second violation within 24 months, 36 months, and so forth. Some towns are 24 months, their suggestions are 36 months. My suggestion certainly is a longer time frame, is a greater deterrent. That you have, now 3 years to have 3 violations, or you lose your license, or potentially have didn't mean to go, down detail too much.
Yeah.
It's all in here. So I said, as you're looking through the bigger packet, all the green stuff are the ones that we would decide as a town. We don't have to adopt any of them, we can adopt all of them. It's really, a discussion between all of us over the course of the next month or two. There's a lot of other changes, a lot of it's just in terms of wording. Like electronic cigarettes used to be, say, 3 sentences. Now, electronic nicotine delivery systems is, 2 paragraphs. Just updating it being more expansive. I see no reason to alter any of that, just the verbiage that the state and federal law suggests.
Yeah, it's a great recap. Yeah, so I mean, it's a lot to get through. The point is not today to, I think Michael's been working on this. He's been doing some of the compliance checks. He's done the research. So I would say, as you're going through this over the next month, if it's something you want to move forward, reach out to Michael directly for questions or clarification. I think we would get together in our next meeting. I think it's best to post that hearing notice early, have that first meeting, notify the retailers, sit down, take that input, work on the draft. We'd like you a clean version, obviously have that reviewed by town council, prior to formally adopting.
I do have a draft prepared with no colors on it anymore, of what our suggestions were. With a cap on permits and a few other things that is a cleaner version, but I wanted to present you with the overall option. Certainly with that front page with a checklist, those are the most important things that the towns would have to decide upon, so I figured I'd leave that in, so everybody can see it.
No, I'm formulating in my head.
Do we currently have a cap on the number of liquor licenses in town?
Yes.
And how many is that? Do you know?
I just got a copy of it. It varies a little bit depending on
Beer, wine,
what they sell to.
spirits.
I won't even throw out a number, 18 maybe, something like that.
I think it's even more, and I believe the cap is not currently met in town, so we could get more of that information for you, but.
Okay, and
I
then
just got a copy of it.
the other question I had was, do we know why the surrounding towns didn't increase their fines if given an opportunity to do so?
Excellent question. I have not reached out to anybody.
I feel like this is one of those things that's serious enough that maybe we would look at a higher fine structure, but I'd be curious to know if anyone else.
I can certainly ask the questions. I would love to go as high as we can and adopt
Yeah.
everything as a real deterrent.
Yeah.
But I don't know why those other establishments don't.
The fact that every town's brought it up to 300 leads me to believe they want it to fall under non-criminal disposition, just for the ability to use that process to recoup those fines, but I don't know that for sure. We did just reach out, with council, we're waiting on the other, so hopefully, we'll definitely have clarity on that question, because it's,
So after 300 becomes criminal?
it wouldn't work
The
under
way I'm
non-criminal,
the
yeah,
way
you
I'm
take them to
reading
court.
this is a violation of the state law, which is theoretically a criminal violation. That would be at a higher fine structure than violating our regulations, which we can only fine up to 300. What we're fuzzy on is honestly what gives us the authority to fine on state's behalf if we collect it. That's our concern, sort of, with council, that they say, you're violating this, it's $1,000.
I have no idea.
And I just walk
Where
with
does the
a
money
piece
go?
of paper that says,
I
here,
think
give
it
us $1,000.
goes general fund,
General fund.
yeah, so we'll find out.
I'm all for it.
So the state sets a regulation, we adopt it, it's now our regulation. Take $1,000 and put it in the general fund. Because somebody didn't put a pamphlet out that discusses something about menthol cigarettes that are no longer even allowed to be sold.
That's why when we did the first round, we did a lot of educational visits as opposed to finding, and our very first conversations, especially with the letters about the menthol cigarettes and so forth. But some of the greater violations would be a violation of the flavor ban itself, selling a menthol cigarette or something. And then like unlocked humidor was another one of the major ones, which we had a couple of those. But sort of our goal would be, the main reason we're looking at this is now that when I can go back now, once we've adopted whatever it is, and now they're in full violation of everybody's regulations, and we can start enforcing it from there. That's sort of our driving behind all this.
So if the kid forgets to lock the humidor, you're gonna hit him for $1,000 and then up to $5,000 and take away the license? Let's say forgot to lock the humidor, he gets fired, there's $1,000. A year later, somebody doesn't put the pamphlets out, right? They get fired, there's another 1,000 or whatever. The third time, another year later, under 36 months, right? It's 35 months, new kid working, I don't know, pick one of the lesser evils. They lose their license, their permit to sell, and they get hit with a $5,000 fine.
In a lot of it, I believe, in a lot of the circumstances, we can add the language may as opposed to shall.
Is that what the may versus shall?
I'm not sure it's in everything, but at least in terms of the suspensions and so forth it is. I believe we can certainly add that to the violations as well and leave it up to some discretionary.
Does the violation have to be different, or can it be, does it have to be the same for the repeat violations? So let's say,
I believe it's written as the same.
so it has to be the same.
Well, this has to be the same.
Well, that-
Or we can certainly
Yeah,
word it
same.
that way, because you bring up certainly a valid point. I would like it to be the consistent, same violation.
And I think it's worth noting in practice, you know, when Michael went out with Kevin, we keep all the copies of the signage. So anything as simple as a sign, we'll make that correction on site. You know, I'm not gonna take all the signs and give, you know, take the time to issue a citation if we could just help them tape it up. So anything, there is a lot of signage required, but all the copies of those printed signs are available for free. We can order on Mass Clearinghouse, and our goal on all of those is just to correct on site.
It should be pasted.
Yeah.
So, I mean, may sounds better than shall.
Shall.
That at least gives a
This is
flexibility
brutal.
to the town.
I think it's brutal.
I think that's a lot.
I mean, we went through this in 2015. This was not as simple
Oh, sure.
as you can imagine. This was a serious undertaking to put together these regulations as they are. So there's certain things that are absolutely required to change. It's a no-brainer. It has to be changed under the state regs that aren't, is that what you're telling me?
We'd want to be in line, right?
We wanna be in line, but
Want
they
to
don't,
be, I don't-
if we just left our regs the way they are, then that's fine, or are there certain regs now that are state and
I,
the vendors gotta follow the state ones even though we don't have listed in our regs? Is that what we're talking about? Or is this just sort of getting everybody on the same page, even though we're not gonna be on the same page with the states, because there's gonna be some things that are in the states that I don't think this board, maybe I'm wrong, I am fuddy-duddy here, but I think some things on this board that maybe we wouldn't want to adopt, such as a $1,000 fine. So if we don't adopt a $1,000 fine, but there's a state reg that's, and I know I'm playing with the fine thing, which we don't quite, isn't clear, but if we don't adopt the, choose something that's the state that would, regulation, how about smoking bars? Are those allowed under the state regulation?
They are. I don't believe any of our 8 local ones allow it. I know there's 3 in Marlboro, I believe, or 2. That's what I heard. I don't know for a fact.
We used to have one smoking bar. I don't think we have any now, do we?
Yeah, I don't think there's any.
Away.
Oh, you have the cigar, that's right.
Yeah, we
Yeah.
did.
It went away.
Actually, had 2. We had one downtown,
Yeah.
it was Bucky Rogers' place, right?
Yep.
And then, wasn't there, but the computer places across from Gary's Antiques and that?
Yeah, that was a cigar.
Is there
That
one
was a
there?
cigar bar too.
Was it, inside that little building
Yeah,
over there?
Fitzgerald's.
Yeah, it's now like a
Institute.
computer,
Oh, that place, yeah.
yeah.
I mean, to answer your question, no, there's not a specific need to update anything.
Okay.
If we have the ability to follow the state regulations,
We'll do it.
then that's the course to take. Our thought was to just get in line with everything else and not have to eliminate questions, certainly in terms of the finding and so forth.
So, in this page where it says, these are not currently in our regulations at the
Correct.
bottom, right?
Yep.
At the bottom, and this is basically to correct those regulations that are
Correct.
missing from our.
I think I have a different order originally, but yes. The ones at the bottom are not there, and the ones at the top are
Yeah.
my
And these all,
recommendations.
the ones at the top that are there are
Yep.
all the state, that are in the state regs,
Right.
correct?
As I said, those are purely I'm aware that there's a lot of
So-
discussion meant to be had.
I think, you know, without getting too much, I think we could go through this list very quickly with 17, with just a yes, no, and if it's anywhere in between, we could save it. But that way we could get, if we were to move forward, a model updated, and if you're all in agreement, we'll just include it. And if you're not sure, we'll leave it how it is.
Checklist, you mean?
Yeah. Do you want me to run through that?
If we
Okay.
vote, not vote,
Right.
but we raise our hand, yes or no?
It's not a formal, we're just talking about a draft language,
Yeah, no, I
so,
get it.
yeah. Okay, so number 1 is no permit renewal if outstanding fines exist. we typically do that, you know, with other types of
Yes.
permits. It's not uncommon that they would
Pay your
have.
fine when you get your permit.
Yep, so, yes.
Yes.
No permit renewal of 3 sales to persons under 21. I think that's a pretty big one.
I think that's fair.
We luckily haven't had any underage sales with nicotine products. They did reach out. We were working on other substance use in town. I did some research on that, and we've had pretty good compliance.
Is that forever or within a certain time
That's what
frame?
I was just looking to see in the regulations.
Okay,
I don't see it
so
specifically.
we'll put a note to
I think
check
we
the
had 24
timeline.
24 months.
Yeah, okay,
So
I'm
time,
getting a little bit of 24 months is more than we're looking at from you folks.
yeah,
versus
for
the
24,
36.
yep.
Okay.
Cap or reduce the number of permits.
no,
Yes. Yes.
delete.
Who, me?
Cap or
Number
reduce the
3.
number of permits in town.
Say cap.
Okay,
Let's
so,
discuss it.
hey, we can put it in
That's
there and
okay.
then you can fight it out when we get a formal
Listen,
hearing.
if you wanna, you know,
Let's
if you wanna
What is it, 3 to 1?
stifle
Yeah.
economic growth of the town,
Yes, okay.
tobacco sales, yes.
So
and
the other
tobacco
one,
permits.
no new permits within 500 feet of a school, but I even question if we have any business area within 500 feet of a school in town, so.
Well, I don't have a problem with that.
Yes, yes.
You never
So just
know.
keep it, it's not gonna hurt anybody.
Keep it.
Okay,
That's a
yes.
We don't have it, so no one can come and ask.
Right.
Right.
No new permits within so many feet of existing permittee.
Isn't that a
I feel like
I'd say
that's a
no.
non-compete and not public health.
Yeah, I don't like
I don't like,
I don't like
I don't like.
3 of the 8 adopted
Well, it
that.
prevents that gas station alley like we've had downtown, so maybe we just don't want all these cigarette stores in the road. Now, would they be an establishment like a smoke shop and a smoke shop, or are we talking like a little retailer and another little retailer that happen to sell it?
I think they're just
I read it
saying
as anything.
new and it,
Yeah,
yeah, it'd be any,
it's
so
the
you're
second,
just,
yeah.
you're saying no new retailer can set up shop right next to another one.
I would say yes.
I say no.
I'd say no.
I would say no.
All right,
Okay.
okay. You can always add any of these back when we get to our official, so.
Right.
Smoke, a ban on smoking bars. There's
Yes.
none right now,
Yes.
No.
all right.
Well, wait, isn't it like a cigar bar?
Cigar bar.
It's a
Yeah.
21, you
Hookah
have to be
bar.
21 to get in.
There's a hookah bar, a vape bar, and a smoking bar.
The
think
one
that's all
caveat
I'm
that is allowed in smoking bars is flavored cigarettes. In the smoking bar, you're allowed to smoke menthol and cinnamon flavored cigarettes, only there.
Alcohol
Can't take it
served
out.
as well?
Pardon me?
Is it alcohol served as well, or is it just a smoking bar?
There used to be
I've
alcohol
only
in
seen it
both
as
of
a
them.
smoking bar, but they certainly both exist.
Yeah, I don't know if we've had that in Northborough. Okay.
Administrative
I'm
question.
on the fence on this one.
Is the Board of Health to promote smoking?
We're not
Look at the
promoting it,
opposite.
we're just allowing it.
Yeah,
If it can be banned, it's not healthy for the community, you know, it sets a tone for the community. You know, we're looking at bringing in revenue, I think there's other ways to bring in revenue, that's
smoking.
my public health hat.
okay. Well, we didn't have a consent. I'll put it in there and then we'll, because I think you guys were
That'd be great
split.
to
And then
revisit.
we can discuss further. And we'll be hearing from the retailers. They're gonna have the opportunity to come forward to look at this as well. Include minimum cigar package size and pricing. This is where some communities have said you can't, if you're gonna sell a single cigar, it has to be a minimum of $5. You know, the idea is to prevent people from just coming in and buying them individually
Using
at
the
low
I'm
cost.
sorry.
Yeah, go
The
ahead.
suggested price is either $2.80 or $2.90. Currently, nobody is under that, so we wouldn't be hurting anybody. We would just be making sure we have.
I feel like that's a weird number to pick.
No idea why, but that's the,
Yeah.
Very random.
agreed?
Okay.
That is a
So
random.
we'll keep it because it's not really affecting, or?
I say no.
Do you smoke cigars?
No. I just think that, you know, you got a right to sell what you wanna sell as long as it's legal.
I would say yes to keep it, because just like taxation has really helped reduce smoking, particularly with younger people, anytime you're adding a cost to this habit that's unhealthy, it may curb it, so
Yeah.
I say yes, but where is Swati?
Yeah, you know where she's going on all these.
Yeah, so I can
We could all
include,
vote for her because we know exactly what she
Yeah.
would say.
8's easy, banning blunt wraps, which our current
yeah,
regs already
yes.
ban it, so we'll just keep that, cause you hashed that out.
I say
Ban-
no.
Oh,
That's okay.
Ban redemption of coupons, which I don't think is all that common. Just like when the marijuana establishments were going in and they say you can't do discounts or coupons to lure people in, so.
Did we skip
You
number
missed
9?
number 9.
Oh, did I miss
think
9?
we did.
Well, that
Ban
was-
free
Oh, yeah, I missed
distribution.
9. Yeah,
Yeah.
ban free distribution of tobacco products.
Yes.
That's pretty typical. Okay. Ban coupons.
Yes.
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 Ban self-service displays, which is pretty typical because
Yes.
it's just a risk. I mean,
Yeah.
Yes.
I think those
That's
are
a
banned
ban.
already.
That would
which
be
are
vending
different.
I think we banned that already, the vending
That's in there.
machines.
Okay.
It's not even.
I didn't think it was.
I have no idea what is self-service.
Yeah, I
I
don't
think
think they
I think
can.
everyone's banned.
I think it's-
Yeah, ban self-service. Okay, so we'll say yes. Ban tobacco product sales in educational institutions is
You've already
typical.
done that as well.
We
Yeah,
did that. Okay, that's typical when you have a
Good.
university.
You've done educational and healthcare.
Okay. Fining structure system, well, I think we'll get to that
14,
later.
add a dual penalty system.
Yeah,
I didn't know what that was. I put no.
okay. I think with the fining structure, I'm gonna say wait on council.
So
So on
14,
on 13, where it's the finding structure system, separately, state and local would be the 1,000, 2,000, 3,000, and then ours, either 1, 2, and 3, or 300. The unified finding structure would be the adopting them directly, the 1,000, 2,000, 3,000, which it doesn't look like that's the direction.
All right.
Well,
I think it's just too high.
I think that's gonna be a big discussion, so I don't, we'll put in a structure and you're gonna hash that out, so. And then the suspension periods, I don't know if there's any thoughts, first
those I didn't
violation.
address really at all.
Tolling period for local, number 16 is tolling period for local violation. State level's 36.
Yeah.
I say no. I say 24.
So very quickly, the state, it's a fine of $1,000, and then the board of health decision up to 30 days suspension if you choose to for a first violation. Oh, that's sorry, that's for a person under age of 21, excuse me. So first violations, there would be no suspension at all. Unless it was the sale to a underage person. In case of the second violation, the permit may be suspended for up to 7 days, and that would be a topic of discussion,
Okay.
if you wanted to at all. Third violation would be, again, may be suspended up to 7 to 30 days. Recommendation, you can put whatever numbers we want, obviously.
So anyway, a lot to go there on
Yeah.
fines. I think we'll break that section out and say where it's coming from and what's in line with other towns. And then, so I just lastly, are you supportive of the shall versus may language on suspensions? Which gives the board the authority to make that determination if they're gonna suspend a license. I think we want
I circled May.
may.
Yeah,
All right,
we'll
I
look at
agree.
the opportunities
May.
in,
I agree.
fines
Can-
as
can we-
well.
Because we're addressing these things individually, can we say yes for some things, or shall
Yeah.
for some things, and nay for other things?
So you'll see it's very typical in like the state regulation, underage sales to minor, shall.
Shall.
Like, there's no question,
Exactly.
you know, but then when you get to, to Glenn's point,
Yeah,
you
the
know, you
literature.
forgot the
May.
7th sign on the list of signs you must post up. And those ones you could, so I think we'll get into the granular.
Fair enough.
So, we don't need a formal vote, but would you like Michael to move forward with drafting this, and we would post those hearing notices? And, I think early it can take a while to get town council feedback right away, but I'll see if they can review an early version that hopefully we're walking in here with some,
Especially the fine structure, 'cause that's what
yes.
we're really waiting on, right?
Yep.
So,
So we'll probably need one more meeting on this.
yeah,
here, and then final, looking for June.
right, that would be my guess. May, we'll have a clean draft, we'll have invited, it'll be an open hearing, it'll be a hearing.
in May.
Public hearing in May, and then we'll continue that open hearing, until any revisions are needed in June.
Why don't we just
No,
have
I
a
think
May
we're
meeting,
gonna
just
get
want
one
us to
more.
review the draft,
Right,
and then have the open meeting in June and July.
we could, sometimes it's helpful as you're drafting it though, to get the feedback from the retailers, cause we can have a pretty good rough draft available, and to push that out based off of this. Then you get all that feedback, you can really discuss it, and then have that next meeting to officially vote it. I think sometimes having feedback and opening that early is helpful than putting all your time into the permit and the draft language, and then you hear in the 11th hour that, oh, you didn't think of this, that will affect my business. Cause we can continue that open hearing.
Plus, we have another month to go over it anyways after.
Right, and I don't know where town council's gonna come in on that review period too. Okay.
Okay,
Anyway, that's fine.
we'll get the pitchforks from here on.
I've heard from other communities, they didn't have
Pitchforks
many
and they-
retailers come out, you know, a lot of these retailers have locations in multiple,
Yeah.
towns, and a lot of towns have already updated these regulations. Our goal, and we talked about this at a recent Board of Health meeting, our goal is to join a tobacco control, group, and, we're trying to work through that process, and I can tell you, our first meeting with our tobacco control group, if we're able to join one through the state, is they're going to say, have you updated your regulations? So we're just doing this work now, so we're
Right.
in line with the other Metro West towns if we're gonna join that group.
I don't see anything in here that's too offensive.
And did the other towns get a lot of pushback from their vendors?
They didn't, they said, you know, they
No.
had, nobody came, and one of the towns is at Southborough, or maybe it was Northbridge when I was speaking to her today, that, you know, nobody came, the first town, you know, the first violation, you know, somebody came, but I did hear from Northbridge has had underage minor sales, but they said they come right in, they pay the fees, it's amazing. But they're working through a tobacco control region, just like Southborough, they did have a fine for, was it youth sales?
Underage, yeah.
And that vendor came in and paid the fine, and they've been compliant since, so.
And the other question that, you know, obviously town council will have to advise, is it possible to have a different fine structure for different violations, like for instance, selling to underage minor, because that's gonna hit them harder
Yeah.
than not putting a pamphlet out.
Yeah, that's the one.
I mean, that to me is,
That's how it started.
you know,
Yeah.
so if they can put a higher fine, whether it's whatever it is for the first, second, and third, and make it different, and I don't know if that's possible or not, I mean, that's what council is gonna have to tell us.
Well, it certainly can. You know, talking about pamphlets, if we're talking about signage, I can carry those with me. And then also with the letters, I now have a zip file from a vendor that has 12,000 letters in it, pretty much. I can also have those on hand. So if I'm questioning them and they flip through, oh, I don't have my, you know, my Marlboro ones, I can provide most of those, non-egregious
Yeah.
violations, and then adopt the stronger
Right, because,
violations.
I mean, I think there are certain things that should be definitely hit them over the head with a hammer.
Right.
But there's other things like, oh, do we really need to go this way?
But I agree as well, certainly even in the flavored tobacco, the two that we found were potential flavor, and it was not intentional on their part. The vendor gave them something that they didn't know, because it's not labeled cinnamon,
Mhm.
watermelon, desert storm, something like that.
Right.
You know, and the vendor was like, oh, is that, oh, yeah, we'll take that right off. They weren't intentionally doing it. Whereas I mentioned at the last meeting, you know, they're hiding it behind the counter in the cooler
Yeah.
to sell it to their friend. And that's not happening in this town. So really the only concern that we're hitting, as you said, is the underage sales. Everything else is,
That's the
we
big
can
one.
work with them.
Yeah.
Good.
Not trying to punish anybody, we're just trying to make sure that everyone's doing the right thing, of course.
Keep in mind, Northborough is a business-friendly community.
If it's healthy.
Sorry to throw so much at you, I appreciate everyone's time. Thank you so much.
Thank you, Michael.
Good. That's some good work. All right, we shall move on to Be Well Northborough. Seems apropos.
All right, so, it's a fun time of year, there's a lot happening on health and wellness initiatives across town. Joanna Graham and the library staff have done an amazing job, they've been pulling together health and wellness programs and initiatives for the spring and summer. What's coming up is May 1st through 7th, the town's hosting their first ever wellness week, and so this has been a collaborative partnerships with schools, the rec department, library, the senior center, and there's a big townwide calendar that's going to be released in the next week or so with a fun activity wheel for kids to fill out. And if they do, you know, all the wellness wheel activities, something on sleep, something on intellectual reading, something about going outside, they can return that form. I believe it's gonna be through their school nurse or the library to get a free prize. So really just trying to connect people to health and wellness resources, and that's a spin-off of our Be Well Northborough activities. We're continuing with the free Narcan trainings at the libraries since that program started in December. Our public health nurses have trained over 218 individuals in Northborough on Narcan administration, harm reduction strategies, and they've distributed this life-saving medication free to all attendees. So that's been a huge response in Northborough. So that's been mostly as a result of that strong partnership with these other, you know, library and schools, and really bring groups out. I was able to attend a junior women's club training where they did some of that work. So they're continuing with that. More dates were just announced on the calendar. April 30th is our townwide cleanup, which I believe is hosted through the Community Affairs Committee. So Be Well Northborough work with them. Then we have some trash picker grabbers to make it a little easier for volunteers to use to get in the poison ivy and pull out that trash on the side of the street. So we'll be deploying those. Those will be kept here in Town Hall, and hopefully reused every year. We're gonna sign them out with numbers and ask for everyone to return those. June 10th is Northborough Culture Fest. June 22nd is the Be Well Northborough Summer Kickoff Event. Again, I was gonna bring the fun sunscreen dispenser down for them to see. Would you, we have these big sunscreen dispensers with Impact Melanoma, and those are gonna be deployed at the parks, 4 of them. We're working with DPW, so those should go out in the next month or so and be there in time for summer. So we'll be giving out through Greater Boroughs free sunscreen, and then there's all the fun free kid things coming together for that. So that's our Be Well Northborough update.
Good. And that's online as well.
Yeah, so bewellnorthborough.com, and there's a whole
online.
calendar of events, it's all
Alright.
there. So there's still free classes at the library. Wellness Week, there's some neat ones sponsored through, I believe, Wegmans is sending a nutritionist out and teaching classes at the library about packing a healthy lunch or healthy snacks. So there's cooking classes. I think there's something about nighttime viewing and stars, you know, in partnership with the Boy Scout projects. A lot of
Wow.
outdoor things and health initiatives that will be happening.
That's great.
That is good.
I had to share it.
Oh, and then I realized we gotta bring that, we'll bring that sunscreen dispenser
Oh,
down
I should
too.
grab
So,
that too.
so these are our fancy, you know, pickers, that we're finally gonna have, and, it's great. Northborough does a fabulous job. That's a community affairs, works closely, and DPW supports that project, so it's been happening for a long time.
Kristen, is Be-Well doing the CPR classes also?
Yes, so we've been, I've been coordinating that, through the health department, and Ally's been great in rec and handling the registration, so those have been extremely popular. So it's typically a CPR course for an individual to sign up online and find somewhere to take it. It can be over $100, you know. So we did find a great nurse, she's a school nurse out of Grafton Public Schools actually, who's been teaching CPR on the side for maybe she said 20 years. And so she comes in with 12 mannequins and she trains everybody beginning to end. It's through the American Heart Association. And so she's been running those once or twice a month, and they're filling right up. And so we did add some additional programs. What we do is it costs us at Northborough $60 to host that through her, which is a decent rate. And then the individual attending pays half that cost, and Be Well is picking up the other half. And the rec department's great. If there's ever a need with aid, they have a way to handle that, which is awesome. We're looking, one of the things at Springtown meeting is that revolving fund for our department. My goal is that our nurse, Erin, will be trained to teach CPR, and one of our state grants will even allow for the purchase of all the mannequins. So I'm hoping we might be able to offer some of that in-house and keep this first aid, AD training, maybe even look to CPR. So our goal is that the health department will try to keep that partnership and offer those, you know, as we move forward.
I think they're also having the defibrillator training as well.
Yep, it's all built in with
Oh,
that
it's all
one,
the same.
yep.
It's all part of
the
CPR.
same.
Okay.
And the AEDs are on order. We'll be deploying one at the park at Ellsworth. There'll be new ones going into all the town buildings, senior center, library here, DPW, the water barn. And
The
those are.
schools already have them, I think.
The schools have them,
schools
yeah.
have them already.
Ours that have been in the buildings aren't the Smart Talk To ones, so we're excited. Ours are currently not the easy, user-friendly Talk To ones, so they'll all be upgraded, so it'll be a,
Okay.
and those
some-
are
We
big
do have
bags.
somebody that services them all, right, in town?
So the good news is we had Be Well fund them, and the fire department's agreed to take on maintenance, which is huge. So
Yeah.
obviously, they have units in all of their, you know, ambulances,
Mhm.
and so they're gonna put it under that contract
Okay.
and build that within the fire department budget. Yeah, that's always the problem.
Yeah, that is a problem.
The
Big
senior
problem.
center was maintaining it through like their friends account and having to have a separate contract for one unit, so this will be a good way of just.
And one
putting them all
standard
together.
place that's doing all the maintenance and servicing and
Right.
that
Yep.
is a blessing.
Okay, submission of drug-free community grant application.
So I think I've been keeping you guys in the loop on this group. So Drug Free Communities, it's a grant that's actually awarded to substance use prevention coalitions. Purpose of the grant is to prevent and reduce youth substance use. So we've had a We've had a coalition in Northborough, Southborough, and I've talked to you before about how it was rebranded Encompass. And so we successfully submitted our grant through grants.gov for the coalition. We won't find out until July or August if we're awarded this grant. It would provide the coalition, Northborough, and the health department will be the host for this grant. And similar to, I believe, like how Natick has done it. So sometimes it's through the health department, sometimes it's through youth and family, sometimes it could be through, a nonprofit. But we'll find out if we get the grant. It was Isabella Caruso, our regional epidemiologist, is a great writer, phenomenal researcher, and she really pulled all the numbers. So I'd emailed all of you that 20-page narrative. It's a lot, but those numbers are really an important read of taking a snapshot of where is substance use in our communities. Even just looking at the different rates of use among young girls and boys and seeing those higher girls' rates are starting to increase. And we really developed that action plan for 1 year to try to hit on some targeted goals. And so regardless if we get the grant, we're gonna move forward whatever steps in that action plan we can execute as a coalition. But be looking for, updates. I'll let you know. It's a great grant opportunity. Hopkinton and Holliston were recently awarded this grant money. And it would definitely give us a great partnership with the schools to support them and prevention programming, et cetera. So stay tuned. Either way, the opioid settlement money will be going towards prevention. There's a whole range. The plan is not set yet, but we'll be, again, incorporating schools. So if this grant's received, it would be in partnership with trying to use the opioid settlement funds to meet substance use prevention needs in our community. So stay tuned on that one. I finally have time in the office now. I think it felt like a full-time job for the last month pulling it together. So learned a lot about federal grant portals. I think there were about 20 attachments we had to upload and certifications of non-lobbying activities. And anyway, it was very cumbersome, but it was a good process. If we're not awarded this year, they always give you feedback. All the forms are neatly saved that we could just make the modifications, continue to build the coalition, and reapply again next year if needed. And it is a 5-year grant, so it's worth the effort. If you get it, you have 5 years, and you can renew it for another 5. And most of the communities around here, like I think Easton's one, Stoughton, Avon, Natick, they all did receive that second 5 years. So I think we could be successful as well.
Okay.
How'd you find out about that grant?
I would
How did you
just.
find out? You just open the newspaper?
Well,
look at that.
it's colleagues. I want to give credit to Southborough Youth and Family Services. They connected us with a great consultant, Amanda Decker, with Bright Solutions. And her sort of job history is she used to work as a substance use prevention coordinator in Avon for maybe 8-10 years. That was her first program out of like an MPH program. And she worked that, and then she's since branched out and helps other coalitions apply for the funding. Because it's really overwhelming application and working within the strategic prevention framework. It's, not always intuitive, and all the goals have to be SMART goals and measurable. You need a whole data collection plan. So I think we found out about it, and just talking Hopkinton and their health director recently receiving the awards. And then Amanda was brought in, Northborough paid for $7,000 consulting cost to Amanda Decker. Southborough, one of their community funds, paid the other $7,000. So we've been working with Amanda for almost a year now to build up our coalition and possibly apply for the grant. So that was a long-term goal. So it's been a year in progress.
Wow,
So
getting there now.
getting there, long process. So we are still with Encompass, and that's sort of next year. I think I've covered a lot of that, but we'll be building up that coalition. Want me to just roll right into that?
No, we have an intern for the summer.
Oh, right, it was out of order, okay. So our intern, we're so excited to be welcoming Gabriella Knox. Gabriella, you all have her resume, or the resume in front of you, very impressive. Undergrad at BU, I believe, public health, working on a master's. And Gabriella will be working on food insecurity, so we had to, when we submit for a possible intern, we have to give a list of possible projects. One that we came up with recommendation Mary Ellen Duggan, our school wellness coordinator, had this idea of, hey, the senior center has this amazing calendar of all these events in town. Could we do something similar on food insecurity? really linking all the greater boroughs, the different food pantries, or Meals on Wheels, or other resources that might be just outside the border, but still somewhere an individual could seek support related to food banks, the senior center, Meals on Wheels, just trying to have sort of a directory and a good understanding of what are the needs in our community, are we meeting them, and how do we refer residents to them. So we'll be meeting with Gabriella in the next week or so and getting that project started. It's really exciting.
Good.
DPH pays Gabriella to work for us.
Good.
$17 an hour.
Wow.
And so it's a really prestigious internship. I think only 20 students are awarded, and they had like over 150 applications.
Oh.
So anyway, you get the best of the best. You might remember last year we had Ariella Levinson, who did a neat project in working with pediatricians' offices about vaccine hesitancy, and did some great work there. So we're excited to have Gabriella, and if you have thoughts on that program, we'll be working with her, and love to give you the opportunity to meet with Gabriella.
Good. Maybe she'll come in on the next meeting.
Sounds good? I think it officially, they start in May. So yeah, I guess the timing would work. I think the 24th, there's like, DPH has the exact start date and end date and how many hours, but we'll work it
Oh,
out.
okay, well, she can
We'll
just send us,
definitely do a
she
presentation.
can just send us a card or something.
Yeah, we'll definitely do a presentation at the end, but we'll, and Isabella, because it's a Greater Boroughs project, Isabella will be directly supervising her in that capacity.
Good. Encompass.
So, just real quick, so we talked about the drug-free community grant. We are gonna start actively recruiting members. We do have just a holding place and Encompass webpage on the Board of Health site. So if any of you have interest in getting involved, level of membership involvement doesn't mean attending monthly meetings, but maybe just volunteering if we're gonna host an event or providing input. So all varying levels. If you're at all interested in just staying, involved, feel free to just go on that website or reach out to me, and we can just put you on the mailing list so you sort of know what's happening around
Yeah.
the coalition, the work that's taking place. We're very excited that we will, I'm gonna hand this around, through a grant with the town of Hudson, we are going to be sponsoring this Encompass Coalition one-day positive culture framework. So if you're in the public health world, you probably heard there's 2 groups out of Montana that do this positive culture framework, where they're really trying to teach you to think about public health from a positive perspective. So not say to your young child, don't use drugs, you'll die. We're all the negative that we all get into, you're gonna ruin your lungs. And really trying to get these positive community norms and really change that framework in a way that's more engaging,
Is that
meaningful.
Is that a pot plant that they're growing in the front of
Oh,
that
I
thing?
didn't even, I don't know what they're growing. I
It is
don't know.
Montana.
I didn't look closely. But, for members, we'll be hosting that one-day positive culture framework. That individual will be coming down from Vermont to offer this one-day training. The attendees are gonna learn 3 lessons from prevention research that form the foundation of the framework. Models of understanding behavior change in a cultural approach. And this session will conclude with an overview of positive culture framework and its components. So we've heard really good things about this group. I wanna say the training, it's not cheap. It might be as expensive as $5,000 to $7,000 for this one-day training. So really a superb trainer coming in. If any of you have interest, I believe there's 60 openings for that one-day training. It will be hosted in Southborough, and I think we're starting off with our coalition and our members first, and then they're gonna be opening it up to other coalition members and sort of that Hudson coalition group. So if you have any interest, please let me know.
It's actually weekday.
It is always, I know. We just expect you all to just retire and do this work full time. So, or take a vacation day to learn about it.
Yes.
So, and then I'm going to go actually out to Montana, June 20th to 23rd. BSAS, the Bureau of Substance Addiction Services, is funding health directors and staff in our area to go out for a 4-day training on the paradox of positive learning. It's preventing harm by promoting health. So it's a training all about this positive framework. And all costs will be covered through the state. We'll be traveling with Isabella Caruso is also going, as well as the Hudson Health Director, their Regional Substance Use Prevention Coordinator, and one of the Natick Health Department members. So I'm excited about that.
That's exciting.
And that's before the training program?
I think it was the day before. I know it's gonna be a lot of positivity.
That's what I'm saying, are you gonna be back to give some?
Yes,
voting on it.
I might be the expert at that
That's what I'm saying,
point.
by that
Yes,
time.
yeah, it's about a week. Yep, the next week. So that's all I have.
Good. Town meeting warrant article, the athletic complex project.
Yes. So you all have an insert, this was continued from our last meeting, so just to recap, many of us were, we attended in January a joint meeting with the Southborough Board of Health. We'll actually be voting those minutes today. We asked questions, regarding the proposed artificial turf field. Really, we're focused on the health concerns, not financial of the project. We did get responses back. I tried to summarize some of the most meaningful responses to our questions in this one pager here. It looks something like that. It's at the end of your packet, right after Gabriella's resume. And so we did have this on the agenda last week. There was a question, Southborough did vote in favor of this project at a prior meeting. I did get their actual motion, and it just said the Southborough Board of Health was in favor. There wasn't, I think one of you might have asked me after, do you know exactly what they voted? So it was really just a generic in favor is my understanding. And it was asked at last meeting that we actually put, I think Dr. Sane asked that we push this meeting up a week so the board could formally make a recommendation or a vote prior to town meeting. So this will be voted at town meeting. So, I can sort of talk through these. I think the product itself is not the tire crumb PFAS. So just a quick recap, it's this EnviroFill, which is like a sand that's coated in this microban. But it's important to note that the planning board did require a third party to actually test this material and actually do some environmental testing at the site. That's been going through the planning review process, and they have approved this project. There is some baseline levels of PFAS out there. So nothing to do with artificial, not really a surprise, because PFAS exist in the environment. But you might, if you're hearing about that, there are existing PFAS just associated with that location. The products that they're proposing are they're saying that they are not going to include PFAS, letter certifying that. I believe the third party's looking into it. Some other questions that the board asked at that January 30th is, are there any other the exact same field they're looking to install in our area? So again, they're looking with it's an EnviroFill, like a coated sand with the Brock is the brand name shock pad, that's inserted with obviously the artificial blades of grass. They did note, just to recap, Shrewsbury, Westboro, and Hopkinton schools have this same EnviroFill with the Brock shock pad installed. There were concerns, again, we sort of covered that, about the release of microplastics and other chemicals, but we hope that the third-party review by, I believe it's Weston and Sampson that's doing that work now, will ensure that they're testing or looking for certification on the turf carpet, the infill, and the shock pad. There were concerns that were raised on injury rates on the field, where if it's not maintained properly, you can see higher rates of injury. There's been discussion about knee or ankle or concussions with contact. And there are just overall concerns about the maintenance over time, is that you need to constantly monitor the field and make sure you're planning appropriately, that it would be, in its condition to ensure student athlete safety while using it. So I'll turn it back to the board, see where you want to go.
I'm not opposed to it.
I'm not opposed to it.
Say we make a motion.
Okay, you opposed to it?
No.
All right, the chair will entertain a motion on the Algonquin Regional High School Athletic Complex project.
Is this the motion you're hoping?
Motion.
Well, the motion's really long, and I don't know if you want to go part by part and say what's important. One thing that was voiced by Dr. Sane after last meeting is that there were certain promises that were made I don't want to say promises. We asked about, are you going to do GMAX and Hicks testing, for example? And, the schools, in an email, buried in a very long email chain, said, yes, we will. So with Dr. Sane, we had a conversation. We want to make sure not only is it done, but where does that report go? So for example, this draft motion or condition item
There
3.
it is, number 3, yeah.
Just really outlines that, this is their writing. The schools have said that GMAX and HIC testing shall be conducted annually by the turf manufacturer, and that's part of their warranty contract, right? So we don't know who the final bid is, but that's already in the spec for the bid. The district has said that they shall continue annual testing for GMAX and HICS rating after the warranty period's completed, for example. All testing results, so this is where I added, if the board wanted a condition to ensure that that went to the right place, we could say that testing results shall be forwarded to the Northborough Board of Health and the school district physician, right now Safdar Medina, within 30 days of the testing. Just so it's great to do the testing, but where is it going? So these are just some recommended conditions. The other thing Dr. Sane spoke to me about is requiring that there's some tracking of injuries, so over time if there's a change. So I drafted this condition 4. I specifically called out from the research what I've seen is artificial fields, if not maintained properly, can lead to increased hip, knee, ankle injuries, is also concussions, but concussions specific to impact with the field surface. Concussions are going to happen on the field, right? Again, so looking that if they could track that information by category and submit that to the school district and same, the Northborough Board of Health, once a year. So over time, you could see if there's an increase in injury, which might lead you to consider replacing the field sooner or later. Or an increase, it could be sooner.
On this number 4,
Mhm.
I feel like there's a lot of data that we would want to get,
Mhm.
but the schools might have a
Not
different
be
way
able
of
to.
putting that data together. So is there a way that we can include that the board shall provide a standardized form or minimum questions or something like that, so we know we're gonna get the data points that we want as the Board of Health versus what they wanna give us?
I think that's a good question. And even as I drafted this quickly, I don't even know if they collect it that way. You know what I mean? Or do they have, so I think we would need to be a partnership and working, I would say with the school physician to determine a tracking form,
Yeah.
to capture these. So maybe this motion,
So, the other thing is, injuries at the time it occurs, they're not gonna have the exact diagnosis. They're
right,
gonna know, oh, so-and-so injured his knee,
right,
so-and-so injured his ankle, and that's day, time, which field, that kind of stuff, But to know, oh, he had a lateral meniscus tear, they're not gonna know that on the field
right.
necessarily. So, I'm not sure how much, because it could take time for them to get to that quote-unquote diagnosis, or do we just need that, yeah, they had an injury on that field? To your point, Teresa.
Right. Well, I'm not one to make work for more people. God knows I have enough of my own work to do. But, if there's a way as part of the tracking that the event gets occurred, so, July 14th, there's a knee injury on the field, but then there's a month later, there's a supplemental report for each of those injuries that occur on the field. The July 14th injury was a torn meniscus or something like that, just so that, we are able to get the finer details on that data.
How about if we were to make it more generic and say that the Northborough Board of Health is to work with the school district physician and athletic director to develop a
Plan for capturing and reporting
plan for capturing,
injury details
Yeah.
and reporting.
reporting injury details that occur on the artificial, because there's a lot of fields out there.
On the fields, on the artificial
Artificial,
fields.
fields, because then we're sort of leaving it open, I like that. The first, number 1, sorry to bounce around, this was really basic. One thing we noticed, there was a recommendation, and I noted it here, there's DPH, back when we had that meeting, DPH has this 2-pager where they recommend tips for safely using artificial field. And one of the recommendations is just signage, letting people and families know, keep your shoes on, wash your hands after use, because we do obviously have a lot of spectators and young children. And so the schools did commit that they would post signage at both of the fields with the manufacturer's recommendations for use. So, the schools have committed to it, so it'd just be a simple sign. So they've already agreed to number 1, I don't see that being an issue. Number 2, again, that's something that they propose that they're going to be looking into, and really 3 and 4,
We requested.
would be what we requested.
Yep.
And again, it's a, you know, I guess the way I have this worded as a draft motion, you know, we don't necessarily have regulatory authority here, right? We're not approving a planning board project.
Right.
So it would be that Northborough Board of Health recommends or supports the project,
Yep.
Right.
provided the following conditions are met, you know?
Yep.
That works?
So moved.
Okay. Jamie, read through it one more time, are we good with those changes, cause I have them written down?
Changes, I think.
I'm good with the changes.
Okay, so we're gonna use the word supports or recommends in the motion. Northborough Board of
I
Health
think recommends.
recommends
Yeah,
the Algonquin project, provided the following conditions are met. Okay,
Recommend the project, okay.
and I have it all written here, so I'm gonna hand that to you, and then you're gonna type it up. So I
Yeah.
think I had read off how we're gonna redo the language on 4. Okay.
Thank you.
Good. Want to just go into the minutes? Can we do any? No?
Well, we just need a quorum.
Oh, do we?
Then we have 3 for each one.
Yep,
3 for
that's all you
January,
need. No.
3 for
Yep.
March. Then we're good.
And so
So-
please note the meeting minutes that were joint between Southborough and Northborough. I didn't put them on letterhead for Northborough, I will, I just
Yeah.
was lazy and I copied Southborough's and said that's what it looks like. So if you want changes, we will
Yeah, I
post
see
them
that.
officially in our letterhead. But that was a joint meeting.
All right, so the first one is January 17th. That was myself, Teresa, Lisa, and Slut. So the 3 of us. That was a good meeting. It was.
January
I
17th.
can see that.
January
4
17th.
pages.
It was a good
It
meeting.
was a good
4
meeting.
pages.
It was vivacious. A lot happened.
All right, I move for any changes, concerns? All right, then I'm gonna move that we adopt the January 17th, 2023 meeting minutes as recorded.
Second.
All those in favor? All 3 of us. Perfect. Next one is the January 30th that we just talked about, the heading Town of Southborough on it. Clear and good. I move that we adopt the meetings from January 30th, 2023, meeting minutes as recorded.
Second.
All those in favor?
Aye.
Unanimous. The third one is last month's meeting, I was not there.
I wasn't either.
We've got delete, and this one would have to wait.
That will wait.
That will wait.
Okay.
Just curious, so I think for consistency, we either wanna use the first name or the last name, whichever one you want.
Okay.
It should be consistent, because here I see sometimes it says Christian, and other times it says black or
We
gay.
have a couple different people, so
Yeah, so
whichever you
just, let's be
prefer is
consistent,
what I'll do.
let's be consistent across the board. And I would suggest even putting the first and last name.
Yep,
Yeah,
just
Not
full
that you
name.
get 2 Johnsons in here,
Right.
or 2, not like you get 2 J's or Sonny's, but
Okay.
you
Sure.
could get 2 Blacks, 2 Johnsons.
Get two Capobianca.
Well, yeah.
Definitely be another
More
French.
likely than Jane.
All
There
right,
are a lot of us.
we'll revise those for next meeting.
May 9th.
That's it?
I do have a question for you, Christina. I signed up to do a,
Okay.
a training.
Yes.
When is that?
Oh, which one did you sign up for?
The OAHAB.
Oh, that's on my reminders. I did write down.
I
That,
put it in my calendar.
I know, I
should
have
put this in my calendar.
Oh, I have it,
Saturday,
right?
May 6th.
it's
May
May
6th?
6th.
Okay.
Yep,
Yes.
Holiday Inn,
Okay.
you should,
You're
so
doing that too, right?
Lisa as
Yes.
well is attending and Michael, so, and Lisa, thanks for sending that email when we registered, so the town is cutting the check, so you shouldn't be paying when you go, it should be all taken care of. We already submitted those for payment. So I'm really excited you're going to that, so that's the annual certificate program at the Holiday Inn Express. You've probably done it at some
I did
point.
in the past.
You know the show. You must have at some
Long
point,
time
Glenn,
ago.
all these years.
It's nice
Did you
and
ever
I
go
close.
can't
to
remember.
Yeah.
Yeah.
He's been here
It's
for
on
20,
Well, if
25.
5 years.
if May 6th is free, let us know and we'll register you, but, excited you're both going to that. I just had 2 other quick updates. You ready? No. Well, we're gonna cover that future meeting date. I do have, important septic repair where there's a variance for setback off the line. We were hoping timing wise, we're gonna, it was a collapsed cesspool on a property, the overflow cesspool, so they are repairing that in a hurry. We will have that on our next agenda. I just don't know a date, cause I am gonna have to set that hearing date. So I think we decided, Dr. Sani, we're gonna move back to the second Tuesday, which is good, cause that's normally been our date, and this room's available. So are we good for May 9th at 6 PM? Okay. I know this individual is very eager to get their septic
Yeah, I don't
system
blame
in and repaired.
Can that wait till May 9th?
I think it can. I talked to the engineer today, and it's secured. It's an overflow cesspool, so their first cesspool is working, and they're
Fine,
pumping that
okay.
frequently, and there's a full repair, you know, with,
It's just residential?
yes, yep. So, yeah, there's no breakout or anything like that, but I know they're anxious. I just wanna make sure that meeting will be important to have that. And the other update, you'll be seeing a more formal email from the health department. As many of you know, at March 15th, the Healy Driscoll administration announced that Massachusetts public health emergency would end on May 11th, which is a formality, but it does relate to FEMA funding and other things. And that's really in line with the federal public health emergency. Our plan for greater boroughs is that we are going to stop all phone calls on COVID-19 at that point. The state back in December of 2021 recommended that boards of health no longer were required to continue to make phone calls for any of the, and again, we only see the PCR results, so it's a very small subset. If you test on antigen, we are not calling you because we never saw that result. But we have been calling for individuals under the age of 6 so we can answer clarifying questions on sending your child to daycare. And we have been calling individuals over 65 just to, you know, let them know we're a resource and that they should seek treatment from their provider. But again, you know, this is no longer recommended, so our plan, effective sort of following this end of the emergency, would be to cease any phone calls. We'll continue to support congregate care settings. We'll continue to, we have to monitor and just acknowledge the COVID cases, so if we see there's a surge at a certain location, like in assisted living, you know, the nurses will
Right.
continue to reach out. So we'll still track them, but we're just not gonna actively make phone calls. And that's really in line with most of, all of our neighboring. We've been going a little above and beyond because of staffing. And we're gonna find plenty of ways to keep them busy on other projects, but our plan was to sort of, we're gonna have to stop at some time. It just felt like tying it to the state of emergency made sense. And the numbers look good. Hospitalization rates, you know, our hospitals are doing okay with capacity. I don't know,
Good.
some thoughts on that?
So no more remote meetings then?
No, the state extended that, so there was
Wow.
you know, now it's allowed. I think it's on the books for another 2 years. It was a.
Are
Wow.
you kidding?
So we can still,
We can
could
still
meet
go remote.
remotely.
and we still have to say that governor's advisory if we
Yeah.
do a remote meeting, or no, without it?
Maybe we wouldn't have, well, John Cordera's no longer here, and that was his thing that we read that. So I don't know if the next town if we do meet remotely. Most other towns I know that are meeting remotely don't read
I
that,
don't read that thing anymore, okay.
so.
2025.
2025, yeah, so, yeah. But we'll stay in our work clothes and continue to meet in person. Is that our plan?
Sounds good to me.
Maybe this summer, you know, if it's a busy time,
You
we'll
guys
go
switch
meeting to
on and
meeting
off.
if we know people are traveling and quorum's an issue.
You know, you could just have it Zoom
Right,
one time, just say,
Yeah.
yeah. let's
Is
have
that
this.
our
It's
fridge
nice to
there?
have an option.
yes.
Why are we putting water in a med fridge?
Nobody's drinking it, it's locked. It's only because if you do lose the temperature by having the water cooled, that will hold temperature longer.
Yeah.
Versus an empty
asking the
fridge.
question.
Who thought?
Nobody's helping themselves. We're just,
Food or drink in a
we're
med
just, we're
refrigerator.
probably end up moving those. You could try to get the water, but it's locked.
No, I'm just saying, I mean, we had DPH come into our office, and you can't put that in this, it's an immunization thing, there's medication in there. Yeah, so I mean.
Those water- those-
It was hammered into me with the threat of a fine
Right.
from the state, not a local thing.
Right.
I was like, well, wait a minute, I see bottles of water with
Now you know the
meds
answer
in there.
next time they come around.
Yeah.
Why is your sandwich in there?
I said, go and ask Kristen.
keeping it cool.
And to keep, yeah, it
Cause
says,
the power goes out.
that way when the power goes out, we don't get an alert that the vaccines have dropped right away,
Yeah,
cause
exact-
we just
that
have
was-
one small vial, so.
Yeah.
But it's all tracked.
Good.
I'm sure the bottles were sanitized first.
I'm just asking the question. I didn't mean to ruffle feathers.
That's a good question.
I'm just saying, cause from experience, the nightmare of DPH coming in, it's like, what are you doing?
No Powerade though, we're not doing
No,
any other.
nothing like that. I guess that's it then.
That's it.
I'm gonna move that we adjourn this meeting.
Sounds good to me.
Second.
All those in favor?
Aye.
Everybody. Unanimous. You're a unanimous board,
Thanks,
though.
everybody.
Except,
Except for cigars.
smoking.
That's for cigarettes.
Cigar.